Cerebral Arteriography. Cerebral arteriography may also be called an angiogram or arteriogram. It is a procedure that uses a special dye and X-rays to see how blood flows through the brain. Many arteries can be seen on the arteriogram, including those of the legs, kidneys, brain, and heart. A cerebral arteriography looks at the vessels in the brain. Without complications, a cerebral arteriography takes around 30 minutes to a couple of hours. A technologist and a radiologist will stay with you while the procedure is being performed. You will be awake during the procedure. You will be given a local anesthetic to help you relax. Next, the patient lies on an X-ray table in the radiology department. A small cut is made over one of the arteries in the groin. A local anesthetic is used to numb the area where the cut is made. This stings a little. A thin, flexible tube called a catheter is inserted into the artery and carefully guided to the area that's being examined. Once the catheter is in the correct place, the dye is injected. The dye is technically called a contrast medium. A series of X-rays are taken as the dye flows through the blood vessels. Some patients get a metallic taste in their mouth when the dye is injected. Overall, the procedure is safe. A few days or weeks afterwards, some people have some bruising or soreness at the insertion site. There is a small risk of more serious complications, such as an allergic reaction to the dye or a stroke as a result, but that's really uncommon. If this content was helpful, like this video and subscribe to the channel. Share with someone that may find this useful. Happy studying!